Hey, it is Wednesday, and it's now my favorite day of the week. I love Wednesdays because I get to have great chats with amazing people, and I'm very interested to learn more about our guest today. But before we dive into our conversation, I always want to thank our amazing founder of Pursuit 360, Miss Shelley Lynn Hughes, because of course, without Shelley, I wouldn't be here with the opportunity to speak with Allison. And so we really want to give a shout out to Leanne Miles, our amazing Pursuit 365 talk Wednesday star. Leanne is with the Clinton Wilkins mortgage team. And thank you, Leanne, for your amazing sponsorship. So without further ado, coming to us, I know from, I believe, Surrey, BC, or somewhere in the Lower Mainland, British Columbia, we have Allison Patton, and you'll see Allison have some fun letters behind her name. So I've learned that she is a doctor, a naturopathic doctor. Is that the proper term to use, Allison?
Yes, that's exactly the proper term. Yes, I'm a naturopathic physician or doctor for
That's
the last
very
20
important.
years.
Okay. Wow. We're like cutting edge for sure, because there wasn't a lot of naturopathic medicine happening that many years ago. Like, I find it's something that seems to have gained a lot of momentum. So you I think are what we might call a trailblazer, whether you would like to call yourself that or not. So what drew you along this path, Allison?
Well, that's a great question. In my university years, I was a science-based person. So I love learning and I love science. So I was studying biochemistry, microbiology. And then after about 3 years of that, I was among a number of pre-medical students. And I found the environment less supportive than I wanted. And also people, they were quite competitive and they wore gray a lot. And I just thought, you know what, I'm not sure if I don't become a professional, I'm not sure I want to, I could work in a lab because I'm people oriented. So I switched after my third year into psych. And I thought, well, I could be a psychologist for sure. So I moved into psych and then finished my degree with that. And then left after university to do a volunteer stint in Indonesia. And that was probably the turning point for what led me to naturopathic, because I was originally interested in psychiatry. And funnily enough, my mother, who's a nurse, who says the most hilarious things like, when I first told her I was becoming a naturopathic physician, she said, well, why would you want to become a witch doctor? And I said, you better change your attitude, because this is your daughter you're talking to, and you might need me one day. And she did. Anyways, then when I reminded her that I had wanted to become a psychiatrist and she worked in psych for a while, she said, well, that would have been a complete waste of your personality. Now, again, these are just, not to insult anybody, but these are just stories that, now I guess she saw something then that I didn't, but whatever. So anyways, in Indonesia, I was exposed to a number of different things that wasn't as available to me in Canada at the time. Things like, I met a woman from Switzerland who used Bach flower remedies. And I also saw some practices happening in Indonesia, coining, for example. So again, these are traditional practices, but weren't, I hadn't been exposed to them. And then when I came back from Indonesia, I had almost like a reverse culture shock. And then I thought to myself, well, through a few other experiences, it led me to realize that perhaps naturopathic medicine was better aligned to my lifestyle and my philosophy than the original plan that I had. So then I just said, okay, that's it. I'm going for that. And that's kind of how it happened. So that's how I ended up in naturopathic medicine anyways. And it was in Toronto, our school. So I was out that way for a while.
Oh, interesting. That's very, very interesting. And it just goes to show, right, that so often life, isn't a straight line, and how we have an idea, but life often has a different plan for us. And listening to you, I
Yeah.
remember heading off to university and thinking I was going to be a sports psychologist, and I'm nowhere even remotely in that realm.
Sure. Well, and
Things
then,
at all. So now I would
well,
love to circle back to your. Go ahead.
yeah. Well, I was just going to say, sorry, I love to talk too. So, okay, I'll try not to interrupt. But another funny thing that triggered from what you said was during my practice, a person had said to me, a mentor had said, go and do your MBA. And I thought, oh boy, more school. And I thought, MBA, what do I know about MBA? So anyhow, I was motivated to do it once I thought, well, if I don't do it and this person dies, I'll regret not doing it. And so that was my motivation to do it, which is odd. But anyhow, so I was doing my MBA, and that was a great thing. I really loved that. But at the end of it, I was given the Governor General's Gold Medal for my thesis. And then my mentor said, well, now you should go into politics. And then I thought I was going to vomit because I thought, oh God, what do you mean politics? And so then I just finished 4 years as a city councilor. So 10 years from the time he told me that, I ended up being elected and just spent 4 years as part of my work working for my city of Surrey. And that was not in my plan ever. So all I'm saying is, sometimes your service turns into something you didn't expect, So anyhow, all a life experience so far.
Well, having many friends and being a former resident of Surrey, I lived out there myself for many, many years. Thank you for your service, because we do need more and more people, that want to make a positive impact on the world, to step up, because that's not an easy job at all. And I'm sure there was a lot of rough patches, but when you stay true to your vision and your mission statement, where you clearly have a heart of service, or you wouldn't be in the line of work that you do. So to take it out of your practice, and give it to your community.
Right.
I thank you on behalf of many of your constituents, whether they thanked you or not.
Right.
So
Well,
that's
thank you. Appreciate that.
that must have been very trying. Very trying. So I want to circle back to when you first spoke with your mom, and she said, okay, you're going to be a witch doctor or a voodoo doctor. So let's dispel that, because I'm sure she wasn't the first, won't be the last, isn't the only. So how do you dispel that myth from people to, stop calling you a quack, or, how, what is ND versus MD, and not that there should be any competition there, but I would love for you to kind of unpack, what that looks like.
Right. Well, and again, I would love to do that. And, keeping in mind, this is my version of that, and it may not be the perfect version. So just bear with me. But currently in BC, for example, about 25% of the people who might seek a naturopathic physician have done that. And there's about 3/4 of the province that hasn't yet. So, and it's not because they don't want to necessarily, it's just they maybe haven't thought of it, or it hasn't come across their path. So the nice thing about that is there are availability and opportunity to meet new patients and help more people. My type of practice has changed, though, over the years, and it could be because I'm at the stage I'm at of practice, but I think it had a lot to do with COVID and what we all went through. And now in our, there's about 800 or so naturopathic physicians in BC, and there's about, let's say, 16,000 medical doctors. And so we all play a different role, but in our area now, there is a bit of a challenge around availability of healthcare, like medical doctors for our patients now. And so a lot of times my work will be filling in the gaps within my scope, of course. And so, but one really neat description of medical doctor or medical or health, sort of the continuum of health and wellness, let's say, was described to me by a medical doctor who specialized in fibromyalgia. And what she said was, there's a big sphere like this, and one side is total health and wellness, and the other side is death, let's just say. So that was her sort of frame. And what she said was, if you're, there's a line that's, you're out of a hospital and then there's death. So in the medical world, how she described it at the time was, if you're heading to a hospital, the medical system will try to keep you out. If you're in a hospital, they'll try to get you out. If you're headed to death, they'll try to stop you from dying. And then once you're out of a hospital and you're, working in the GP realm, there's that area, but then to wellness, like here's that, but then to wellness might be way over here. And this is the gap where a lot of times the naturopathic world fits, is not necessarily, when a person's in a hospital, but if they're trying to support their health beyond what they can receive in that paradigm, they may pursue my paradigm. And that's kind of how it had been described to me, which I'd say is true. But it's even been expanded since then, because in BC, we can prescribe drugs, over 500 drugs. It doesn't mean that's our first priority, but there is standard of care. So if someone comes in and they have a pneumonia that they've been able to show with an x-ray is a pneumonia, and I'm the only one they're seeing and there isn't somebody else they can see, then my standard would be to prescribe an antibiotic as part of their program, because that's what is needed to cure the problem. So in other words, we work to help heal the patient, or work with healthy, making the patient more healthy, or the person, with the tools we can work with. And they may be a drug, they may be a herb, it could be a change of diet. And of course, you try to remove the obstacles to cure, but it's not using, I'm not mixing up a concoction of whatever I find in the back lab room and whatnot. So it's usually something standardized, something that has been shown through research to have a benefit. So a lot of times they'll say evidence-based, integrative medicine, something like that. So that's the kind of thing that I might be doing with patients on any given day. And I'll pull out of my toolbox a tool that I think will help them.
Perfect. Now, do you work alone in your practice, or do you have other modalities or other physicians that align with you?
Well, for almost 20 years, I was working with a couple of partners in a clinic that over the years had a number of different practitioners come through. And then through COVID, it shifted to more of a solo practice. So I work on my own as the only naturopathic physician in my clinic, but I also have an acupuncturist. And so she provides therapy to her patients and my patients when needed. And then I'm exploring maybe adding a physiotherapist next. So of course, COVID changed everything, where, there was nobody wanting, the trend was don't have anyone around, keep everyone apart. And that was needed and important, but you have to get out of COVID and move on. And now I'm entertaining, including others in my practice again. It was nice after 20 years working in a huge, a larger team, to learn how to work on my own again. And because I'd never done that actually. And it's a different type of work. And for me at this stage, I actually like it right now. Like, it's suiting me. So yeah, so and I have some staff, and, and I do my IV therapies and my facial rejuvenation, hair rejuvenation. So, but I'm kind of like a one-woman show right now, the last few years. So
let's talk about that. With the so hair rejuvenation and facial rejuvenation. Is that what
Yes,
you
and
said?
I mean, that's a term that
Because I know before you and I hit record.
yeah, yeah, I said facial rejuvenation, yeah. Well, here I was talking to an aesthetic salesperson the other day, and they were mentioning to me the research is showing that hair rejuvenation and restoration is going to become more popular than Botox over time. And the reason being is through the last few years, there has been a huge increase in issues with hair. And that could be for many different reasons, but immune system issues, stress issues. And so there's a large interest in this field right now. And this is something that I was learning about in 2015. So it's not new to me, but it's sometimes you're ahead of the curve kind of thing. So you just have to wait till the trend catches up, I guess you could say, or the need catches up to the knowledge.
So what would be the main difference then between, this and Botox then? You know what I mean?
Yeah, well,
Never having, experience
right.
either, but I've recently speaking with a nurse that practices med aesthetics, and she does Botox and whatnot. And I suffer from migraines, so I've had a number of people, that I've reached out to say that Botox has made a huge, impact on their migraine.
Sure.
So then, right away when she moved in next door, I'm like, okay, tell me more. So now that you're sort of comparing, this as I just love to learn.
Yeah,
I'm very curious, so I'd love to
definitely.
hear more about that.
Yeah, and I don't do Botox, so I'm not an expert in Botox at all. But Botox is definitely helpful for migraines as like a medical use for Botox. And what the woman meant by popularity is just right now, if you look on let's say on Instagram, everywhere you look, if you're following more aesthetic channels, there'll be Botox. That's a key treatment that people are, even younger people are starting to use. And I purposely chose not to go that route, only because being a naturopathic, even the naturopathic physicians in BC can do Botox and when they're trained and no problem. But I've just chosen to stay with the using substances that can come from the body, like platelets or growth factors, and using vitamin C, like different areas that are more within the realm of what I've had experience with and feel comfortable with. Doesn't mean I wouldn't or couldn't or shouldn't learn it at some point, and I may. But all they meant by the comment was that so that's the level of popularity of Botox, and what they're suggesting is that that's where the level of popularity with restoring the hair is going to go next. And how you deal with hair restoration is a few different ways. There's the one that I learned was linked to drawing out taking a blood sample and extracting growth factors and platelets. So when you spin blood, you get a clear part of the blood and a red part. And the clear part is the platelets. And that's where a lot of the healing factors sit in the blood. And you can extract components and signaling cells from those platelets and reinfuse them to the skin, to the hair, and trigger responses that stimulate the collagen, fibroblasts, hyaluronic acid, hair follicles. And it's quite powerful medicine, actually. It's quite powerful. And what I love to see now is when I first brought it out and brought it up in 2015, people were kind of like, huh, what? Whereas now, MDs are in it, like NDs, MDs, MDs, everybody. So it's very mainstream now. And so whereas for me, I almost have to get re-excited about it because I've kind of not been there, done that, but I was really, really excited about it in days gone by. And now just the nature of my practice, I have, I spend my time a lot more in helping with, when a person has high cholesterol, when a person is having, low iron, or I'm more in the medical side of the naturopathic medicine versus in that side. I don't have as much time for it right now. But anyhow, over time, it's still important to talk about, because this is an issue that I'm seeing in my practice showing up, where people were developing alopecia or, thinning of hair or hair falling out, and they're really worried about it. It's very worrisome for them when they're losing their hair, of course.
Well, yeah, because for so many women, their hair is their identity.
Yeah.
And I think hair is one of those things that physically sometimes more men struggle with, losing their hair, than compared to how a woman might feel about certain things. Whereas me, I love a nice bald head, but I was
Right.
just curious too, because I've just heard recently that there's something out there even known as COVID hair, that so some people that had a bad bout of COVID. I know a gal I was acquainted with her over the last couple of years, and she lost a ton of her hair due to COVID. So is that
Yes.
even something that you
Yes. I think
really
that
see
is
in your practice?
Yes, that is part of why I think there is a surge right now, where those individuals, and there were a number that it did impact their hair afterwards. So we are seeing that more and more. And another therapy that's coming out are called exosomes. And exosomes is almost like the next generation of this growth factor or PRP treatment. And exosomes are prepared products that are more topically delivered. So let's say PRP or concentrated growth factors could be injected or put on topically after a needling treatment, a microneedling or a radiofrequency treatment, and or so it could be topical or injected. Whereas the exosomes, which the people who sell the exosomes or promote the exosomes will say they're sort of the next level of concentration or the next level of advancement for rejuvenation, and you apply that topically and it absorbs and then triggers the response. So there's becoming more and more and more developments in these they're called regenerative fields, whether it be joint regeneration, facial regeneration, rejuvenation, hair rejuvenation, and they've been using them in vets, like with animals, for 40 years. So, and in dentistry, so that they're not new, but they're being funneled to different focuses. And the aesthetic world is really advanced in that area, because I guess as we have a longer lifespan, whether we like it or not, there was some data, especially in the case of women or those identifying as women, feminine side, there's a study done saying that if you appear groomed, you earn 35% more. So I took appearing groomed as appearing fresh. So for example, and this gets a little more political, but if, for example, you'll see those on television that suddenly they're let go of their job when they're not as youthful as they used to be in appearance, or et cetera. And you can go on and on. But whether you like the reality or not, if it's the reality, I want to play to that reality and make sure that woman earns as much as she can. So I want her looking good. So, even from that perspective, more and more people are being interested in how to look fresh or how to look, rested, and that comes from inside, but you can also help it on the outside. And lots of people are doing it. So it's nice. It's fun I find it interesting and fun to be aware of the new trends.
Oh, absolutely. Absolutely. And so, okay, I'm going to keep pulling on this skin rejuvenation thread now. So, you hear, there's collagen and there's this and there's that. So this skin rejuvenation, does it work with the elasticity of your skin? Does it work with, it gets rid of your fine lines and wrinkles? Does it deal with age spots? Is it removing something from the skin, and unveiling something underneath? What would the process look like? I say, okay, I want my skin rejuvenated. What
Okay,
kind of process would you put me
right.
through for something like that?
Well, usually I would first, yeah, I would talk with you and see what are your goals. So some people, most when they've done, again, I always refer back to studies because, again, as a studier, I always study the studies. But most Canadian women, and these are what the studies were done on, are happy with about a 10-year, looking about 10 years younger. So between 0 and 10 years younger is what they're looking for. They're not expecting anything more than that, which is good because that's about as much as you can expect from trying to make a change. And so there's all kinds of changes that can be sought after. And in the aesthetics world, they're always coming out with new technologies and machines that can promise this or promise that. And again, I'm not an expert. I'm not a plastic surgeon. I'm not that. But I study them all. And what I've noticed is I do have a couple of machines in my clinic, but I believe my experience is my favorite treatment is still the hand done treatments where I hand inject or I topically apply products like your own growth factors, your own, rejuvenating factors from your own platelets. So meaning you yourself is treating yourself. I find that still the most pleasant, natural, and effective treatment that I've found. Although it doesn't mean I don't implement some of my tools. Like I have a microneedle wand. Yes, I might microneedle someone, and or I have a needleless applicator called a Jet Pro. Yes, I might use that because that person doesn't want a needle, right? So then I use the needleless. So I figure out who's in front of me, what is their tolerance, what is their budget, what are they wanting? And then I make a plan for them that fits them and hopefully gets, fits me too, but it's really about them. And so that's how I would do it with you is, so say one patient of mine said, okay, here, just tell me what you want me to do and I'll do it. So I made a plan with her to do 5 treatments over, it might take about a year. The first 3 are about 6 weeks apart. And then we do maintenance, maybe we wait 6 months or 3 months, probably 3 months. Then we'll do another treatment, then 3 more months, another treatment. Then that's the year. And then what we'll do, or that's close to a year. And then what we'll do is maybe once a year after that, minimum, we do something. Otherwise, as people say, like the most common question, well, will I have to do this forever? Well, no, you don't. But whenever you do something, if you don't maintain it, you keep aging. So what do you like? There's only it's not a miracle cure, but it's like a process. So for me, I'm 22 years in practice. So I have patients that now have kids and I treat their kids. That's, I guess, a good and a scary thing at the same time. But my point is, I don't want a patient for just a month. I would love my patients to work with me through their time frames and through their phases, through their journey. So we're not in a big rush to get this solved, but if you want to embark on it, let's go for it. And of course, people can go here, there, and everywhere, but I'm quite a loyal person when I seek out help. And if I can find a fit with a patient, it's nice to have that loyalty back so we can work together and you get a better outcome in the end. So that's my favorite kind of interaction that I get to have if I can, if I can make that connection with the person and it suits them as well. That suits them.
Perfect. So if somebody, some of this chat is resonating with somebody and they're intrigued and they want to learn more, or they want to, maybe reach out to connect with you to see, if you're a good fit. Where's the best place for people to connect with you, Allison? Is it through a website? Is it, through social media? Is it, just call your office? Like what's the best way for someone to connect with you and learn more, or maybe vet you, or book an appointment, or like, what's even your process there? Is it a consultation first? Is there an overview, or?
It's very, funnily enough, so the, one answer might be, yes, there's a process, but really everyone's unique. So a lot of people will most of the new patients I see will say to me, if they haven't been referred by their friend, they usually look at the website. So ardourwellness.ca, my website, is where they can get a feel for who I am. So that's probably step one. And then from that, there is a booking like a link for booking, so a person can book online, to see me, and then come in and see me, and or they could call the clinic, and or so I'm quite flexible myself. So again, I'm trying to meet the needs of the patient. That's my goal. Of course, there's boundaries that you have to have, but I'm other focused. I'm less self-focused. So I try to, if they need to text me one time just to connect and then I get them in, okay. I mean, that's fine. So however they find their way to me, I'm here for them. And otherwise, yeah, definitely calling the office and emailing us, whatever they need to do.
Well, you, again, I've known you for a whole 30 minutes, and you can really see that you do truly have a heart of service. And so thank you truly for sharing, your passion and your gifts with the world, and I love more and more how we are being empowered, to realize our gifts and to lean into those, and to have these platforms to share that. So thank you for that. And yeah, so you're doing incredible things. So as we're wrapping up here, we're gonna wrap up with my favorite question that I've been using in these Talk Wednesdays, and it's just a little opportunity to get some insight into Allison, the person. We've learned a lot about Allison, the doctor or the physician. And so this is just an insight into maybe a different aspect of you. So the question goes like this, Allison. If you were to give a TED Talk on nothing that you are known for, what would your TED Talk be about?
It can only happen at the end of next summer, okay? Because I haven't done what I would do my TED Talk on yet. And so I would give my TED Talk on how a glamper goes on a 7-day kayaking trip where glamping is pretty much not allowed. So that's what I'm striving for. And I'll let you know how that goes.
Oh, wow. Yeah. That's very specific. Yeah. Yes, we will tune back in. I think that's what we're going to have to do, is we're going to have to do a whole other series of maybe Talk Thursdays on whether anybody actually puts any of these TED Talks into reality or not. But Allison, thank you so very much for your time and for sharing your story and your heart and your passion. Yeah, it's so incredible to me as I meet more and more people on this platform, how somebody's energy really can come through. Like you and I are on opposite sides of the country, and I can feel your passion. So again, thank you for putting your heart into what you do, and keep on helping. And thank you everybody for tuning in today and for your support. Thank you again to Shelley and to Leanne for this opportunity. And everybody have a fantastic Wednesday, and we will see you next time. Thanks, Allison.